Assalamu alaikum wa rahmatullahi wa barakatuhu. Our beloved viewer, welcome yet again to this episode of Health Checker program where we give you medical advice. We bring medical experts to assist us regarding certain elements affecting our health. And with me today is again our brother, Dr. Abubakar Kange. You're most welcome once again.
Thank you, Bashir.
Welcome to the MTA studios yet for the second time. He's been here for the second time. Last time you saw what we discussed, and today we have something yet new and quite interesting, and that is the SCD. That is the short term, which means the sickle cells disease. What are the sickle cells? That is the main reason you are here.
Thank you, Bashir. Before we go into the details of sickle cell disease,
yes,
we have to understand that sickle cell disease is one of the most common genetic. Keyword genetic is genetic. It means you inherit it.
You inherit it
from both parents, not one parent. You inherit it from the parents, and it is one of the most common genetic diseases here in Africa. And actually, if you are to look at the global statistics, it is mostly common here in Africa. And you find that almost about 300,000 babies each year are born with sickle cell disease. So that shows you how its impact is important for us to discuss it.
Okay.
Back to the question, sickle cell disease is a hereditary disease where we find that the hemoglobin, the carrier of oxygen in the red blood cells. The red blood cells are like the cells, the vehicles which help us to transport oxygen in the body.
Okay.
So their hemoglobin happens that there is a mutation in that hemoglobin. So what happens is the red blood cell, which is supposed to be round, it ends up being crescentic, like a moon, or crescentic, and not in the normal shape it is supposed to be, so that it can easily transport the oxygen in the body. So that's ideally what we understand by sickle cell disease. And you find that when these cells change their shape to a sickled one, they will not be able to move in the blood vessels. What happens is that they end up clogging, how I always want our viewers to understand this science, like to look at that world we are explaining, like our own outer universe, the things we are able to look at. So what happens is, imagine if a bus was made the way it is and you put it in the deck. That means it will not be able to move effectively.
Yes.
So it is the same thing. The ideal shape of the red blood cell is supposed to be round. Okay. But we find that in sickle cell disease, it ends up being sickled or crescentic, and that means it will not be able to move smoothly in the blood vessels. It will end up reaching somewhere and it clogs. Just imagine buses you have brought a mail on land. That means even if you put 20 ships on the road, they will just get stuck there. They will not be able to deliver.
They can't. Yet it has a bigger engine as compared to that of the bus.
Yes, exactly. Even though it has that, it will not be able to move very well.
Yes.
So it is the same story with sickle cell disease, that our oxygen carriers, which are supposed to transport oxygen in the body, they have a challenge in the shape, a deficit, a mutation occurred, and they are not able to move very well because of that.
Thank you so much, Dr. Abubakar Kange. Now you've said that this disease is hereditary. How widespread is it, the condition in Africa?
Like how I initially stated, it is most common in Africa. That's one. It is in other parts of the world, but it is most common here in Africa, most especially in the sub-Saharan Africa. If you look at it, you will find the countries like Nigeria, Democratic Republic of Congo, Ghana. For them, they have a higher prevalence of about 25%. In that is about 1 in every 4 individuals you may find them with the sickle cell disease. So the prevalence varies, and in Africa, it is most common in Africa, and most especially in those countries in the sub-Saharan region. But also in these other countries, for example, here in Uganda, still you find it here in Uganda, and you find it still here in Uganda. Other regions are going to have a higher prevalence compared to other regions.
Okay. Thank you so much, Dr. Abubakar. Like you said, since it's hereditary, many people are born with it but don't know, because many mothers give birth to their newborns without going for antenatal care in the hospitals. So I assume that many people are born without knowing that they have sickle cells. How can one realize the key symptoms? How can people know that such and such a person might be having sickle cells?
The hallmark, like what you said, here in Africa, most people are not aware that they have it. So it is always the symptoms which will trigger us, most especially from about 6 months of age is when we can start realizing when because when you are born, you have a certain type of other hemoglobins. For example, the fetal hemoglobin. For it is not affected by this mutation in the hemoglobin of S, the one you have. So mostly the symptoms will begin from about 6 months onwards. And the most common symptom we always find, the hallmark of all symptoms, is always the pain. Because what happens in the body, like I told you, the red blood cells, their role is to transport oxygen in the body. And these cells they feed on this oxygen. So if they are not receiving it, it means they are going to trigger the body. And that's where you find that most of the pain is coming from lack of oxygen to those regions. And you will always find, so the one I can say the most important one, the most common one, is the painful crisis of sickle cell disease, which we always call the vaso-occlusive crisis. That these already blood cells which are sickled, they will end up forming a chain, like a polymer, and they get clogged in the blood vessels where these cells are supposed to pass, and in the end they block. That means when they block where nutrients and the oxygen is supposed to pass, that means the other area is being cut off. And the pain you get is as a result of that. The body feels like for example, you just in normal instances, when you block your nose just for about 30 seconds, you feel that you are exhausted and you want to die off. It is the same thing inside our body, that when a certain region is cut off, you are going to have those painful crises. Okay. But there are other symptoms of sickle cell. For example, you may have fatigue, feeling weak. And the main cause of that is always the anemia. Because the anemia, the low levels of blood. Because we find that in sickle cell disease, the life cycle or the lifespan of one red blood cell is supposed to be about 120 days. But here in sickle cell, a cell which is supposed to live for that long, about 120, in the world of cells, that is a long time. So a cell which is supposed to live for up to 128 days will only live for 28 days and it is broken down. That means the body is going to be overwhelmed and it will not meet up the demand. And it is these red blood cells which determine the amount of blood you have in the body. So if they are being destroyed so much, for example, when they reach the spleen and they clog there, they are just destroyed. So you end up having the anemia. Another thing you may have is what we call jaundice. Jaundice is yellowing. So you may find someone with yellow eyes, someone has these lips are yellow, or even the skin can also become yellow. So what happens is that when these cells, the sickle cells, the ones with sickle cell are being broken down, there is a substance which is broken down called bilirubin, and it is that bilirubin which gets deposited in the eyes, in the mouth, and the skin, which is causing the yellowing. Okay. Also, we have other symptoms, like if you are to look, since when this blood, these sickle cells are moving in the blood vessels, they end up like, just imagine, like how I told you, imagine this is a world of its own, with its own roads.
Yes.
In the road where cells or vehicles are supposed to pass, these ones have come and blocked the junction. That means you have cut off supply the other side, you have cut off supply this side. So what happens in that case is that your joints are going to swell, and you will find that in most cases, these people, what we call dactylitis, they are going to swell their joints. It is because blood supply to the other ends has been cut off. And
broken.
Yes, it has been cut off, it has been broken, and you will have that issue of swelling of the feet and the hands. Also, you can have delayed growth in children. You also have, since you are always sick, because when you have sickle cell, there is any increase.
The children don't grow as normal.
Yes, as normal. You are always sick, you're in the hospital, you're always in pain.
So someone is 20 looks like as if he's 11 years old.
Exactly like what you have said. And when you find these people, mostly they are like that. And they are at risk of infection because, one, the spleen is in your body. Just assume, just to know there is also another factor in your body called the spleen, an organ called the spleen. Its role is to help filter in this blood, filter infections which you get in the body. But when these sickle cells get there to the spleen, they also end up blocking it. That means it will not do its work. Okay. That means it will increase your risk to infections. And there are also severe cases where you can get stroke due to the steel blockage. And there are high chances of you getting another stroke in case you have ever gotten stroke.
Okay.
From
Thank you so much, Dr. Abubakar. I think that is quite understandable. Now let's go at the part of screening and diagnosis. How do you screen or diagnose these sickle cell diseases, most especially in the African setup where everything is limited?
What we always do, we encourage, for example, like you have specified to be in Africa, since we are still having those challenges here. Yes. In Africa, but in the other world, you will find that almost everyone, every child who is born, for example, in the US, every child who is born is done a test to know if they have sickle cell or not. And here in Africa, largely, you find that most people only come when the symptoms have set in. So we can only look at their family history and also the signs they are presented with. But the tests we do, ideally, we are supposed to do these tests at birth, when a child is born. But there are other tests, since our science has really advanced. There are even tests we can do when a mother is still pregnant. We can still go there and take off a sample and test and know if this child is a carrier of sickle cell or has sickle cell or is normal. But here, largely we do specifically two tests. That is the solubility test. For that one, we get a blood sample. for the babies, we prick at the heel, the prick test. We take off a sample and mix with some substance. And when we see the crystals, we can say that there is sickle cell here. But the like a gold standard, the one which we always do is the electrophoresis, HB electrophoresis. That one helps us to when we do that test, the different hemoglobin types, the like for example hemoglobin S, the one for sickle cell, hemoglobin F for the babies, the fetal hemoglobin, then the HbA, the adult hemoglobin. For them, when you are subjected to that test, there is a scale. So we can see that when this one ends here, that one is the hemoglobin S, that is the one for sickle cell. When it ends here, HbF, that is the fetal hemoglobin. So it's like a scale. We put all that blood sample into a test and we see where will this hemoglobin end. And depending on where it ends, in reaction to the charge, is where we can say that, oh, this one has HbS, and which is for sickle cell.
Okay. Thank you so much, Doctor. Now this takes me to the management and treatment. If there is any treatment for sickle cells, we need to know what treatments are there and how they vary in as far as our different parts of Africa are concerned. So how does it vary in case there is any across different parts of Africa?
What we have to understand is that when we are managing sickle cell disease, yes, we majorly focus on managing the symptoms which a patient comes with, or preventing the complications which come with sickle cell disease. So largely our management is depending, because it is hereditary, it's not going to go away. So we are going to manage the symptoms which come with it. For example, in most cases, I told you, the hallmark is pain. They will always come with pain. So we manage the pain they have. We also, in most cases, they come when they are dehydrated. Since they are undergoing a lot of pain, they lose a lot of water. So we have to also hydrate them, in that even their blood vessels, we help them add more fluids there, so that the cells are able to move very well. And also, in case they have an infection, we can treat the infection with antibiotics, or we can also treat the trigger which caused that crisis to happen. But currently, we have a promising drug. I want to call it promising because it has been effective in reducing those episodes of crisis, the sickle cell crisis, the hydroxyurea. And you find that for it, there are different ways it works, that it will increase the body to have a certain type of hemoglobin, which is going to not be affected by the other issues which are affected by the sickling of the sickle cell. And also, it has very many mechanisms it is working, but only what I can tell you here is that it is promising, and it has been proved to reduce the frequency of the symptoms with which people of sickle cell disease always come with. And also, like how I told you that we always manage the symptoms. So in case a patient comes, because they're always having low levels of blood, we may end up transfusing them after knowing that they meet the criteria of being given blood. And also, like how I said, is that the treatment generally in Africa varies depending on the affordability of the government, and also on the individual basis. So it varies a bit, but the main principle is that we manage the pain and the complications which are related with it.
Okay. Now, from what you've explained, it's like as if for now we are not rest assured that it is curable. Since you are a doctor, do you see it in the near future that this treatment, I mean this CD might be curable in the near future? What does the future hold
Uh,
specifically for this
the,
disease?
the future in the management of sickle cell disease, people should know that there are those who are spending days and nights in the lab, in the books, are trying to understand how they can improve in the management of sickle cell disease. And for people living with sickle cell disease, the good news is that there are now good studies concerning gene therapy, where we are trying to study how to collect these the defected genes which are mutated, so that you do not produce that type of hemoglobin, which is giving you sickle cell disease. And also, there are other potential cures in gene editing, and also we are looking at, for example, depending on the complications you have, but since the main concern is always the pain, we are looking at finding better ways of managing this pain. But also, it is crucial that we should always, currently, we should focus on what is available with us. And like, for example, in Africa here, we should ensure that this promising drug, which is doing wonders in people living with sickle cell disease, the hydroxyurea, it should be accessible and affordable across Africa.
Okay. What impact does the sickle cell disease have culturally and in the African communities and socially?
In the African community, always the challenge these people living with sickle cell disease, which they are finding, is the stigma attached to the sickle cell disease, and the people having a misconception that maybe sickle cell disease is contagious. Someone may discriminate you, that maybe you infected them with forgetting the other basic principle that this is hereditary from both parents. You get it from both parents when they give you those genes. So people think it will be contagious, and it affects them. Also, it affects marriage prospects. If someone realizes that you are living with sickle cell disease, they may turn out to that offer they were extending to marry someone. Also, it affects the patient's mental health, even the caretakers themselves. We have seen, since most of the times these people are in the hospital because of the pain, you find that your mental health, you will not have time to focus on the other things. You find that your mental health is going to be greatly affected. Even the employment. If you are youth and you are living with sickle cell disease, and you get a job and you miss out a day because of the pain, your employer may discriminate you because of that. And also, even in education itself, and the social integration in society, they are all affected because of the life which they go through. So we really encourage that the communities should be supported, and the people should be educated, and we should develop support systems to help these people who are living with sickle cell disease, as we look at the future where we can get better management modalities.
Okay. Dr. Abubakar, unfortunately, this is the time we have to say bye-bye. But before we go, do you have any message that you would like to leave out to someone that is living with or that is at risk of having the sickle cell disease?
To our viewers who are living with the sickle cell disease, I want them to understand is that the world has not forgotten you. There are advancements in the field of medicine which are currently focusing at improving your quality of life. And also, for those at risk, it is important for people to know their sickle cell status. In quotes, people should go for these tests, and they should know if they are carriers, because if you are a carrier and you also marry a carrier, you can go for genetic counseling. They tell you what are the chances of you having a child with the sickle cell disease. because it is 25%, but it can end up that you may have all the children having sickle cell disease. So it is better people should understand that things are there now to help you know that you a carrier or you have sickle cell disease, and even at birth it should be good if we increase the screening of these diseases, and also to seek genetic counseling. And people should know that together shall be able to change the narrative surrounding the sickle cell disease here in the entire world, and specifically here in Africa. And we should make sickle cell disease a manageable condition and not something we should fear.
Thank you so much. Thank you once again for honoring our invitation. Thanks for such an insightful, educating, and advice medically. I think it helps you, our viewer. This is the very reason we invite these doctors here, and I hope this program has been of a great benefit to you. It's time to say goodbye, and until we meet next time, I remain your host, Nambale Bashir. Assalamu alaikum wa rahmatullahi wa barakatuh.